problem, right?
You said she was out of Suboxone at that time, or no?
She wasn't on anything yet.
Yeah, she wasn't on anything.
This is a patient, 37-year-old female, presenting to the emergency room department for a possible overdose. Patient states that she is currently in the Suboxone program and typically becomes very tired after she takes it. She states that she fell at home after taking her Suboxone and reports missing 90 Wellbutrin tablets. Patient states that she is concerned that she may have taken them. She denies any fever, chills, nausea, vomiting, diarrhea, abdominal pain, chest pain, shortness of breath, or suicidal indications, homicide, ideation, visual hallucinations, or auditory hallucinations.
She's coming normal, and they didn't just try to briefly hand her a charcoal just to make sure everything was okay.
Yes.
Because if they would have did that, nothing would have happened. It just been a simple report. She would have went home, and it wouldn't have been a big deal. But one cup of charcoal would have solved this entire incident.
Yes, it would have. Would have stopped all that. It would have stopped it, yeah.
But she obviously wasn't anything else but exactly that.
Well, I mean, that's why we have lawyers working on this. Because I'm not going to let them get away with this. If it takes me, for every last breath I have in my body, they killed her. I don't care what anybody says. They didn't have, the nurse that did this, it was one nurse, took it upon himself. My doctor told me this. His words were straight up. Andy said they fucked up. That's what my doctor said to me. He took this report home for a week, and he went over this, and he said, I worked at that hospital for 10 years. I know for a fact. He said, first off, when she came in the door with an overdose, she should have went to the critical care unit. That's not where they took her. They put her in a regular room in the back. He said, plus, with the change from what I told him about the way they changed over, he said they went through changeover, which is when doctors leave and come in. He said there shouldn't have been none of that with her. She should have been taken to critical care, pumped her stomach, and give her some charcoal. That's what should have been going on. That's it. He said,
this is a real hard way to lose your sister over charcoal.
That's what it is, but that's what
charcoal saving. So my sister ain't worth charcoal.
She went there to get help. It's plain and simple. She went there for them to help her, and they failed to do that.
I mean, but that is a very simple procedure. It's the thing. I mean, the loss of your.
Tell me, Mom. I know it's simple. I know how they acted when I got there. Like they were in a hurry. And I asked him, "What am I keeping you here?" And their answer was, "Well, I'm sorry, Miss, but she's been here an awful long time." So they wanted to hurry up and get her out
for a long time. Well, I guess she has, because you killed her and she can't walk out because you didn't give her no charcoal. So of course she had an awful long time, obviously. It's what it sounded like anyway. I mean, of course, if you would have gave her charcoal, she would have got discharge information, she would have went home.
Yep.
And there wouldn't be a lawsuit against you and somebody's daughter and sister.